3.
Okay, today we have George here, and George is going to get a filling on tooth number 19. So we're going to be doing a posterior composite for him today. All right, so before the doctor comes in, I'm going to go ahead and check a shade just to make sure that we match his other teeth. So let's see. George, I'm just going to check to see what color we want here. All right, I'm going to go with 59. Okay. All right, George, there we go. All right, so we'll bring doctor in and then we're gonna place topical. So we have our topical here and we have our 2x2. So we wanna dry before we place topical. Okay, so 19 is here. So now we're going to place this back by the retromolar pad. So I'm gonna dry and then I'm going directly in to place the topical and it stays in there. Okay, there we go. We leave that in for a few minutes, and then Doc's gonna go ahead and get our patient numb. We wanna make sure that we've checked the expiration date on our anesthetic, and we have the brand name up, so doctor knows what they're doing. Gonna hand me the cotton tip. We're gonna go thumb, fingers, slide. Cap goes directly into the needle capping device. And then I'm gonna get my air water and my saliva ejector ready. Doctor's gonna recap.
Okay, just a little
All right,
pinch,
George.
George.
Okay, I'm just gonna put some water in there, George, and rinse that out for you. So I'm just putting water in that area, just a little bit, and then suction. We don't wanna spray it all around because then we'll get topical all over his mouth. All right, Doc, I picked shade 59 if you'd like to verify that.
Okay. Looks great, George.
All right, so 59
Thank you
it
very much.
is. All right, let's take a look at that area. So we're gonna pass the Explorer in the mirror into her hands. Go.
All right.
Take a look there. Now I'm getting ready with my HVE and my air water because the next step, our doctor is gonna go ahead and remove the old filling from there to put a new one in. So I wanna be one step ahead.
Okay, this should be quick.
All right. So what we want to do is make sure we retract the cheek. Okay, we're going to go turn our suction on, and then we're going to go down in and retract. Kind of go next to the side of the tooth, if you can see that. Right there on the side of the tooth. Okay, so let's do that again. So we're gonna go here, and then we're stable. Go ahead, Doc, we're ready.
Okay.
Good. So your doctor might drill out a little bit and then realize, so when she stops, I'm gonna go air and water and then air. I may have to drop down to get the water, so I'm gonna use my air water syringe to hold the cheek back and go get the water. Now, your doctor may want to use the spoon excavator to get things out. So what I'm going to do is I'm going to put my air water in one hand. I'm going to reach over here and get the spoon, come back, get it ready, and I'm going to take the handpiece, give her the spoon without suctioning the cheek. Okay? Then I'm going to get my handpiece back to where I can give it to her. Notice the burr is facing down, so she's ready to go. Ready to receive the spoon, handpiece goes back in, then I'm ready. Let's do it one more time. So I'm here, keeping my suction in. She comes out, I'm gonna take this, give her the spoon, and then I'm gonna get my hand ready to give it back to her. Okay, take the spoon, give her the handpiece. Now she's done with the spoon, I'm gonna drop it, come back to my air water. Ready to go. Okay. She stopped. I'm going to go air, water, air. All right. We ready for the matrix, Doc?
Yes, we are.
Okay.
Yep.
All right. So now for the posterior, we have a different type of matrix system. So we are going to give her this type of sectional matrix So I'm gonna give her the cotton pliers. She's gonna grab this from me.
There we go.
There we
Perfect.
go.
Thank you very much.
Mhm. There we go.
I'm going to hand this to you
Mhm.
real quick. Thank you very
I'm gonna
much.
track for you if you'd like.
All right,
There we go.
perfect. That'll be great. Nice to have 4 hands.
The next thing is the wedge that she's gonna wedge in between where we're missing the wall.
Okay.
Then this will be the clamp that's gonna go around and hold the band in place. So I have it all ready for her so she can go in and just place the clamp. Now you want this ring, this back of the ring to face the distal, so towards the back of the mouth. Okay, I'm gonna take those from her, give her these. You need to come out of there? You got it? Okay.
Thank you.
There we go. So now we have the matrix system on there. So now that means that we are ready to build up that wall. So she's going to start the filling. I want to put in some isolation in there first for her to make sure we keep the tongue out of the way. Yep, put that in there.
Okay.
Good. And let's put it in the cheek too to keep it out. Doc.
You're doing great, George.
Yep, hang in there, George. Now you want to be careful to make sure you get it under that ring and don't knock that matrix system off or your doctor is going to be pretty upset. There we go. All right, so the next step in our process is going to be etch. As she's getting the etch, I'm getting my HV and my air water ready. I'm going to put etch all around that tooth. And remember, etch stays on the tooth about 15 to 20 seconds. Good. Okay. All right, so we're gonna go in there, and you want to, if you can see, I'm gonna suction off most of the edge first after the 15 seconds. So I'm gonna suction and then kind of roll to the side. So suction, and then roll off so I can catch everything that all the water that she blows off of there. Okay, make sure there's no water back there. Good, all right. Next is gonna be our primer. So we're gonna use primer. We're gonna use the purple stick for her. I'm gonna block where I don't want her to go. Let's go here. I'm gonna get my HVE ready because she's gonna blow air. Good, take that one. I'm just catching whatever she's blowing off of there. Okay. Next, I'm gonna give her the blue, and then I'm gonna have her go in 3. Good, and she's gonna blow air. I'm done with that, I can set that down. She's gonna blow air. Okay, and then we're gonna cure that material. So we're gonna put the light cure on it. So I'm gonna cure. Beep. Good, all right. So now we're gonna put some flowable down in the bottom of that prep. Okay, remember, we need to be quick on our light cure for the flowable. Good, I take it directly in with my curing light. Beep. Okay, next is gonna be your packable, which is in the gun. I'm gonna place that. With the packable, I'm gonna give her the condenser. And she may do this a couple times. She may condense it down a couple and go back to the gun. If not, you're good, Doc?
Mm-hmm.
Okay.
Thank you.
All right. Then we're gonna cure. Beep. All right. You need any more composite, Doc? Are we
No,
good?
it looks good. I think
Okay.
we're ready.
Okay. So now we're gonna take off the matrix system. So I'm gonna give her the clamp. We're gonna take the clamp off with the forceps. take that from her. Give her this to take out the wedge and the matrix. Good, take that. And then we can check it with floss. Take your mirror, Doc. Okay. It's a long floss.
Mm-hmm. That's okay. All right, got a good contact.
Okay, all right, great. So you want to check it with the articulating paper?
All right.
Good.
Come on, George, just bite down a little bit and side to side. Okay, good. That's
right.
good.
Oops. That's why make sure you keep your tray clean, huh?
That's fine. Okay, we need to do a little reduction.
Okay, perfect. So when she goes to the handpiece, I go directly to my air, water, and my suction. Now, while she's getting that ready, I'm gonna kind of throw away some of my cotton stuff over here in my trash because I don't need that anymore. She'll be getting her burrs ready. Okay, okay, here we go.
All right, let's go ahead and there we go.
So air, water, and air. Rinse it for her.
Okay.
And then you want to check it again?
Yes, please.
Okay, I'm going to come out. Go ahead and bite down for me, Bob. Or George, sorry. Sorry, George. Okay, good. How's the look, Doc?
Oh, it looks great. We'll just do a little polishing.
Okay, perfect. All right. So now we're going to polish that up. So remember with the polisher, this is your slow speed, so we don't have water. So I need to drop small drops of water while she's polishing that too.
Okay.
Just drop, so it's like this. Right over top the tube.
Okay, all right.
Okay.
How's that feel? Nice and smooth?
Smooth to your tongue? Okay, good, good, good. All right, George, I'm gonna give you a nice rinse and then I'll get those cotton products out. So if you can turn towards me, perfect. All right, we're gonna rinse his whole mouth. He's all done. As I'm rinsing, I'm getting all those cotton products wet. Good. All right, I'm gonna turn this off in one hand, come out. Get my cotton roll. Get my cotton roll. All done. Those are gonna go straight in the trash. Everything feel pretty good there, George? All right, you
That's
are
great.
all set. Clean you up here a little bit and you'll be on your way. All right. All my stuff in the trash, all my disposables gone. There we go.